Well, anemia is defined as a low red blood cell count or a low hemoglobin and hematocrit. Those are measures of the red count in the circulation. But anemia means lots of things to different people and different physicians. Many people feel that because they are tired, that's a symptom of anemia, or if they're told they're anemic, they may feel that the symptoms they're having are explained by that, and many times that's not the case. But anemia is often taken for granted as a simple process, that sometimes iron pills can take care of it, or some other food supplements from health food stores or your supermarket. Sometimes they're helpful, but sometimes they may cover up a cause of anemia that may be important to understand. So even though anemias are approached simplistically, often by taking iron, that may not be the answer, and it's often important that they be the symptom and the findings of anemia be evaluated in more depth. Well, the most common cause of anemia that we see in malignancies is iron deficiency, but it also can be if the anemia is caused by the cancer affecting where the red cells are produced, which is the bone marrow. And the bone marrow can be sensitive to chemotherapy, which affects the bone marrow's production of white cells, but also red cells. And also the bone marrow can be impacted by cancer invading the bone marrow and occupying that space. In addition, there's always the possibility that a cancer is causing bleeding and loss of blood. And that can lead to anemia just from loss of blood, but it also can lead more slowly to anemia by loss of iron, which is contained in the red cells. Many times, patients don't have symptoms from anemia. They have symptoms and they have anemia, and sometimes it's thought that the two go together. But often the body adapts to being anemic, and even significant anemias that anyone might worry about because it's below normal may not truly be the cause of your symptoms. Iron deficiency anemia can sometimes be associated with a term called pica, P-I-C-A, and it stands for eating or craving things that are not food. And the most common associated pica phenomenon with iron deficiency is craving ice or chewing on ice. And that's fairly common. Sometimes it can be more unusual cravings, even craving dirt. These are not frequent, but more frequent than you'd expect if patients are asked about it. Sometimes they're embarrassed by that type of craving. But that's very unique to iron deficiency and not to other forms of anemia.